Hi, everybody. I'm Dr. Vera Singleton, and I want to welcome you to a quick overview about what exactly the perimenopausal program is and why this might be the savior for you. See, perimenopause is this time and phase of life when there's a lot of things that are unsure and unpredictable. So I'm going to take you through this particular program, the ins and outs, and what you can expect from it so you can get some predictability around these hormonal changes that are happening. And the key here is I want to teach you how to reverse the symptoms of perimenopause. A lot of times we just assume that it has everything to do with estrogen and progesterone, and that's just 40% of it. There are so many other systems in the body that are really struggling in this time frame, and that needs to be supported. This multi-system dysfunction is what makes you feel so ungrounded and unsettled. So the goal of this program is to get you feeling grounded and back to normal. And guess what? We're going to use natural medicine to do it. I'm Dr. Vera Singleton, and I'm a functional medicine and perimenopause expert. I have been working with women to reverse a lot of the symptoms that they experience with thyroid issues and adrenal fatigue and full-on burnout. And a lot of these symptoms all coalesce together when you're dealing with perimenopause. And of course, when you lead up into menopause, it gets even worse. But most women suffer for years leading up to the period of menopause. We all know menopause and the typical hot flashes and the night sweats and the day sweats even, right? And we all understand that. But what about this phase of perimenopause, the time period before menopause? There's a lot of disruption that happens. You need someone that's an expert. I have extensive training. I've been featured at numerous events. I have 5-star ratings in Google and Yelp, and have done training through A4M and voted best doctor of the East Bay. There's a lot that is coming to the table and 10 plus years of expertise working with hormones. So this is something that I really shine in, I really understand, and that's why I'm offering this program so that you get a really succinct view and can move through these symptoms really, really quickly. So why is this program for you? Well, nothing is currently being done to help perimenopausal symptoms because you're not really broken. You're not really fully into the phase of menopause. And that's where all the answers exist currently. There's nothing really in that space of perimenopause because most times your primary may think that you're depressed or you're just having anxiety attacks and may just end up with a prescription for Lexapro, right? Or Xanax, and that's it. But what about all the other symptoms that are coming along with it? They might make you feel marginalized, or even your partner might make you feel marginalized because, it's not really a thing, or you'll just get over it, or this is just a phase, this is just part of it. Yeah, but that doesn't mean you have to suffer through it the whole time, right? And the worst part about it is the testing is just usually not run in this time period, right? You'll do a couple of markers, which I'll show you a little bit later. But for the most part, there's no testing to see where your hormones are. And there's a reason for that. But for the most part, if you're trying to get control of the symptoms, and because this is a multi-system failure, you need to do the appropriate lab work. To say that there's no hormones that can be run in perimenopause is completely false. And to top it all off, there's no traditional treatments that exist. I mean, if you don't want to be on birth control and you don't want to be on hormonal replacement therapy, there's really just nothing for you. And we all know that there's risk associated with birth control and with being on HRT. So what's in the middle? Functional naturopathic medicine is in the middle, and it works wonders for you for the symptoms that are in between. Not quite fully in your reproductive phase, but not quite in the menopause. And this schematic gives you an idea of the reproductive life cycle. And as you move through it, you'll see that period right in the middle of perimenopause, right? You have the irregular periods, the night sweats, the weight gain, especially right around the center, and it's really hard to get rid of it. You've got the hot flashes, you have the loss of libido. They don't mention here, but brain fog is very common. And even your skin and your hair loss is a really big one in perimenopause. We expect these things to happen in menopause, right? But this time period in between can be really unsettling, and there's something that you can do about it. So is this you, right? Have you been feeling like things have just been changing in your body and you just don't understand? And like I mentioned, having more weight around belly and hips and your energy level. Why? Because again, multi-systems are dependent on carrying you through this time period. And we know this because when your periods are around, you might have more amplified symptoms of PMS, and then your period disappears. and then when it comes back, you're bleeding out with clots and feeling anxious and night sweating, and all of that is combined together, right? And you may even have been induced into perimenopause or menopause through surgical hysterectomy or ovarian failure. It's more common than we would like to talk about. Or even if you had endometriosis or very heavy periods or fibroids, using Lupron or other GnRH agonists to control your menstrual cycle can actually throw you into perimenopause. These are things that we don't talk about, and we don't talk about the side effects. And when I say we, I mean the medical community. And it's really unfair because it doesn't really set you up for success. And to be honest with you, you may just not be ready for that midlife change. I mean, there's a lot of psychological, oh boy, heaviness that comes along with changing into that phase. You know, you always expect yourself to be a certain way, and then you get to this phase where your periods just disappear and you're used to this predictable, moon cycling, and then all of a sudden she just disappears. Or the anxiety just ramps up, or all of a sudden you're hot and you have to take off all of your clothes, or you're the hottest person in the room. Nobody tells you about this. Nobody prepares you for it. But I'm going to help you prepare for this, right? And perimenopause isn't all about just estrogen. As I spoke about before, you have to consider all of these other systems, your adrenal system, your thyroid balance, your gut goes wacko in perimenopause. Why? The changes from estrogen, progesterone, testosterone, all decreasing, impacts the gut flora. The gut flora really does crosstalk to all of these hormones. So when you have this decline as you move through this phase, bada bing, you're going to need to do the work on your gut. Not to mention changing ratios, and lots of things really shift to amplify weight gain and slowing things down. Because again, you're not in that same reproductive popping out kids phase like you were 5 or 10 years ago, right? And oftentimes I see blood sugar imbalances and of course nutritional deficiencies because, you've been working your butt off your whole 30s, most of your 40s if you're there, and into your 50s if you're still perimenopausal then. You're burning through your reserves. And all of these systems that I mentioned, all are taking a cut from your nutritional reserves. Are you doing what it takes to replenish them? Do you even know where your levels are? I'm sure that you should know, right? Because this is how you can successfully get into the next phase of being a happy woman in menopause, right? You have to cover these bases. If you're not doing this, you're leaving so much on the table, okay? This is very, very common menopausal lab work that I'll do. This is just a snapshot from a client of mine, perimenopausal, but this is really, really common. Thyroid is off, making you feel like you're just sluggish and slow, low energy, constipation, weight gain. The cholesterol is high because you're starting to lose that estrogen balance, that estrogen protection against the the cholesterol. Your A1C is probably popping up there, and insulin is never run. Look at this. This is a roadmap. What do you call that? A herald to insulin resistance prediabetes, that insulin level. How many of you get your insulin levels run? Very little. I do this type of in-depth blood work on every single one of my perimenopausal patients. And of course, FSH is very typical. This is how we get a clear diagnosis of perimenopause. Usually in FSH, if you start to cross over the 20s and 30s and 40s, absolutely, right, you're in perimenopause. But this particular sample I took from a woman who is actually still cycling, and her FSH was 163. She was so happy when I got that down into the 15s for her, all using natural methods. And remember, perimenopausal periods can last 2 to 10 years. Are you going to continue feeling like this for 10 years? It's insanity. You don't have to feel this way. You don't have to wait until your cortisol levels are flatlined. This particular woman had no energy in the morning. She was a high performer, so she pushed herself. Coffee in the morning to get her energy up, and you see that black line, that's her cortisol output. It was not functioning, right? That green curve, that's normal. And you see where she is, it's flatline. And not to mention how you get that peak up in the cortisol at nighttime, that fourth value. She wasn't sleeping. This is what a typical adrenal fatigue burnout cortisol curve looks like with someone that has insomnia. You would not believe how many people, number one, don't get this level of testing done when they're in that phase, and number two, walk around feeling this way. This is unacceptable to live your life with levels like this. You don't have to. So wouldn't you like to wake up feeling alive and energized and banish this feeling of burnout, like you're burning the candles at both ends, right? Get rid of the belly bloat, that fat tummy that's just hanging around, the spare tire. Aren't you tired of you grabbing it in the mirror or not being happy with what you're looking at in the mirror? And just feeling really blah, right? Because your body's not performing. Either too much, right? Hypothyroid or Hashimoto's going on, or your liver's just bogged up and you got fatty liver because of the high thyroid, or because you're just eating off, you don't know what to pick, right? Or just rebalance your body. Like, just rebalance your body. Clear it, detoxify it, allow your metabolic system to work for you, right? And of course, burnout is very, very common. I told you guys that I am a burnout expert, right? I see a lot of high performers who are just completely burned out, and those cortisol curves in my practice, they're very, very common. I am really good at fixing that, right? And really good with helping people that have insomnia to get control of those cortisol curves and all the other accessory hormones that are responsible for sleep and sleep production, right? It's not all about melatonin. So if melatonin is not working for you anymore, there's a reason why, okay? And of course, you want to get rid of those perimenopausal symptoms, don't you? It's time. So in walks the perimenopausal program, right? Like I said, we'll look at your adrenal system. We'll look at the causes of why your HPA axis is going out of whack. We'll look at your thyroid, because that's really important. We're also going to look at all of the sex hormones, not just estrogen, but all of them, and look at how they all work together, because this is what's going to take you through the next 5 to 10 years and feeling good and feeling like you got it together, right? And then, of course, there's your medical history. Do you have any genetic polymorphisms that if you do decide to do HRT and you know that's a thing for you, whether it's synthetic or bioidentical, you need to know how your body is processing these hormones so that you can use bioidentical or HRT safely, right? You don't want to take hormones and then introduce more of this carcinogenic, cancer-causing profile in your body. What's the point? You might as well just stay with your hot flashes, right? So my goal during the perimenopausal program is to help you optimize and return your hormones back to a normal level. We do diet revision, right? I put you on the right diet for your physiology, not just because AIP is cool or Whole30 or paleo or whatever diet is up next. I put you on hormonal specific diet for you. It's individualized. And the program is individualized totally. It's 8 to 12 months that we're working together and we're balancing your perimenopausal symptoms. Now it's tough, right? Because the symptoms are changing and your hormone levels are fluctuating. So it can be a little tricky. It's like a moving target. But when we do a collective testing, you get the entire picture of what all of your hormones are. It's really easy to pinpoint down on the key ones that are really fluxing and then stabilize them. And not to mention, like I said, I do it naturally. So if you're not interested in using bioidentical, if there was cancer history in your family, if you were estrogen dominant or you had ovarian cysts for most of your life or fibroids that you're getting over, or you're just bleeding out and you're not interested in hormones, you can do this through herbs and diet. I've done it before for many, many clients. So what are your steps to get started to book the perimenopausal program? Well, first and foremost, I'm inviting you to book a free 30-minute consult. Get to know me, right? I want you to feel comfortable with this investment of your time, energy, and money that you're about to spend. And let's talk about you and let's talk about what's happening. You know, every person that comes into my practice, even though the symptoms are kind of the same, there's an individual story. So there's an individual approach that I come with to every single patient. I don't just follow a cookie cutter protocol. Every single protocol is individualized for you and for your physiology and for what's happening in your life cycle. That's very, very important for you to know. So then once you're comfortable and you want to move forward, then you're going to book your initial consult. It's a 2-part visit. Both of the visits are an hour long and we get down to the nitty gritty. So in between your first and second, we actually test your hormones. And so by the second visit, you know exactly what's going on. There's no guessing. There's no muscle testing. Not that I don't believe in it, but that's not what I do, right? I'm here to get really objective data so we can make objective decisions about how to balance your body properly. And then once you get the test results back, I lay out the strategy for you. Then you powerfully choose to get started on the road to being symptom-free in perimenopause. And I tell you what, being on this road it's a sticky one, right? You're going to experience up and downs, but here's the thing. During this program, I'm going to teach you how to manage your body so you can get total control over it. Even though it's unpredictable, it's predictably unpredictable, right? Because the thing about the human body is it loves to stay in a tight range. It doesn't like to really go outside and do something really wild and crazy unless it is inspired to, either by stress or some type of traumatic event like, divorce or death or losing a parent or something like that. And that's when, things get a little crazy. But for the most part, when you understand your body, it's really, really easy to manage it. And that's my job, is to teach you how to manage your body and to get control of these unpredictable symptoms that happen in perimenopause. So I invite you to get started. And if you're really ambitious and you're assertive, like I know you are, and you just want to get started, go ahead and book your initial consult. Let's just get started on this, right? Let's not waste any time. Let's not waste any more time. Thanks for being with me. I hope this is super helpful for you, and I'll see you at your